Well, hello out there. So this is going to be my video series on Morton's Neuroma and the surgery for that. So a little bit about it, the history. Here we go. Um, Basically, I had carpal tunnel surgery on both hands. This was about 4.5 years ago, and when I was recovering from one of those surgeries, I first noticed this pain in my foot, which was very similar to the pain I was getting in my wrists, which led me to believe that it was nerve related. And of course, it felt a little bit like whack-a-mole because I had one hand done, the other hand done with carpal tunnel surgery, which went really good, by the way. That I have some videos on those if you want to look into them. But as I'm taking care of that, more nerve problem, another one popped up. And that was 4 or 5 years ago, and basically it was intermittent. It was comes and goes. It's feels very similar to have like carpal tunnel. You know, the symptoms, which are burning, itching, pinprickly kind of feeling, um, numbness, and pain, basically, that you're going to get in the foot. It also feels like your sock is always on funny, like it's crumpled up, and then you go to check it and it's perfectly fine. So there's weird sensation at the bottom of your foot, and there's also feels like there's a marble under the ball of your foot as you're walking, which is another odd sensation, of course. And essentially the symptoms just get more severe. They happen more sooner, is in more frequent. I mean, you get more severe, more frequent. Then it got to be where started getting difficult to fall asleep, because that's actually when I had the worst pain, was trying to fall asleep. And laying down is when it would flare up the worst. And you take your Advils and your ibuprofens and aspirins and things like that, and try and ice it and massage it, and eventually I had to go to the doctor. So then we tried a cortisone shot, which is pretty serious. I mean, experience as far as, the needle goes, I'm going to just use my hand here, so the needle goes straight through the foot. And he told you, yeah, you can feel it poking at the bottom there, can't you? And I said, yes, I do. So, goes in very deep, and it has to go right into the nerve too. So that goes without saying that's a difficult thing to go through. Anyways, it worked, so that was the good news. The bad news was it came back. So about 2-3 months later, after the cortisone shot, it comes back quite a bit. This confirmed, though, that we had the Morton's Neuroma by going to the doctor. I was pretty sure I had it based on the research I did, based on my experience with the nerve pain before, and just some of the symptoms. But you go to the doctor anyways, and you make sure. So that's what I did, and it turned out to be, they took X-rays, they do some, some procedures on your foot, just with the hands. He sort of squeezes it, kind of like this, and he also does this thing where he grabs your foot on both sides, and he can kind of get a click or a pop in there, which isn't supposed to be there, and that really hurts. So that's all indications. And with the shot working but wearing off, those are all indications that we had this problem, Morton's Neuroma. So after the shot wore off, and the symptoms came back even worse, probably the worst I've ever had. So it came down to, the choice is, do we continue with injections, or do we do the surgery? Those are your choices. So, and it's a choice. You can also choose to do nothing. So that's another choice. But and you'll have to make your choices, and you'll have to talk to your doctors and see what's the best option there for you. So, but basically, I chose the surgery because I did not want to go through waiting and kicking the can down the road. Basically, I feel like the injections are, and then there's side effects of the injections as well. So you can only do so many before you start possibly doing damage. So we had the surgery, and the surgery ended up being yesterday, on the 28th of January, 2019. I got there around noon. Surgery was at 2. They give you this little bottle of soap, bacteria anti-scrub, surgical scrub soap that you're supposed to, take a shower the night before with, which I did. And then they tell you, all the other pre-surgery stuff, such as don't eat or drink or, watch your medications. Just listen to what they tell you, because you could be in a very different situation than me. But in general, they want you to come in with an empty stomach and without taking any medications that might interfere with the surgery. And that was all well and good. And then, you get to the waiting room and they call you in, and then they start hooking you up and testing you and asking you questions. All very normal stuff, having been through 2 other surgeries. So they get the IV into your arm, which isn't too bad. And then everything, all the questions are fine, and with they do the blood pressure, they check your finger, I believe that's oxygen, and all that went well. Then you get the nerve block, essentially, is the next thing, and I'll talk more about that in a little while, but basically that's another pretty much procedure right before the surgery where they pull you into another room, and it was at least 2 shots, one behind the knee and one above the knee, and that's been by far the most intense thing in lots of ways. So I'll come back to that in a bit, but didn't think much about it at the time. After the nerve block, you pretty much go to the surgery and everything's ready to go. Of course, they put the whatever knocks you out into your IV and some oxygen, and next thing I know, I'm waking up in recovery. So I'm waking up in recovery. I got to see a picture of the neuroma. I don't have it, but obviously it was a mass, and it was a neuroma. Normally is your nerves are supposed to be the size of a pencil lead, but when you get a Morton's neuroma, the nerve inflames to the size of almost a pencil, and there's no room for it in your foot, and it hurts. So pretty much that's what I saw in the picture. It was a sizable neuroma that needed to go, and it was gone now. Just some post-op simple directions, and start heading you toward the car. I get in the car. I actually went in the back seat and laid down in the back seat, which was, I've never done that before, but it's okay. Brought some pillows. Got home. Getting in the house was a trick, no question about that. You're definitely going to need somebody to get you in and out of to the hospital, driving you, and being put under and all that. So I get home, and that was yesterday, of course, and I begin to notice that nerve block is fully on, fully activated still. It literally completely numb my leg from my knee down, and that was certainly the intensity of it was amazing. How numb it was, and I couldn't move my toes, and I couldn't move my feet at all, and that was actually a little bit concerning until I looked into it a little further. It's actually very normal, because that's what a nerve block does, is blocks your nerves and takes away temporarily feels almost like you're paralyzed. But thankfully today I can move my toes just a tiny bit. I am taking some pain medication that I got. That's up to you, and your doctor. You go and talk to them about that, and see what works for you. But what the method we're going through is stay ahead of the pain. So obviously the nerve block is blocking out most of the major part of the pain, period of the pain. And I'm actually taking the pain medication so that the pain medication is kicking in as the nerve block goes down, so that there isn't a lapse and that I'm ahead of the pain. And it was tough to fall asleep last night. It's a big procedure and a lot going on, and but not in any particular pain, just which is good, of course. Obviously the nerve block, that's been the biggest impact, and getting around is tricky. I'm using a cane, and luckily my house is small, and my bathroom and bedroom and refrigerator and everything where I have to be, the places I need to be, are very close by, so I can hobble 2, 3, 4 hobbles and stay off my foot as much as you can. Now think about it, when your foot's completely numb and you can't control it at all, you don't want to put no weight on it, so you'll need something. You won't be driving, I won't be driving till even 6, 7 days after my surgery. They want me to, for the pre-op appointment with the doctor. Still can't drive on that, I'll have to be driven in. So that's where I am now. It's a little longer video, hopefully it's helpful for you. Keep in mind your situation may be completely different from mine. One thing I'm learning is you can't compare a new surgery to a surgery you had before on a different body part, in a different way. Although, so I mentioned the carpal tunnel at the beginning, but I'm finding more and more that's a very different experience, because I did one hand at a time, I could still walk, I still had another hand to use, they don't cut very far in. Recovery went really well. So this is, I'm pretty much handicapped, and I can't walk. The cut was much deeper. They're literally removing a nerve from your body. And I still don't know what's next. I don't know exactly what kind of pain I'm looking at. Will it be severe? Will it be moderate? Will it be mild? We'll have to just see, what's going to happen. But you're doing all the things you need to do to prevent it, which is icing it, elevating it, taking the medications that your doctor told you, staying off the foot. I'll show you real quick. Basically, hopefully you can see. Right now it's just wrapped up and got my little ice pack on it, and that's about it. So that's where I'm at. One day after, I'm sure I'll do a few more videos on this series, and hopefully people are enjoying it, and in terms of finding things that they can learn from it. Haven't taken a shower yet, been putting that off. But a couple things I've learned is there are products where they're slip-ons that you can slip on over and reuse. They're plastic bags that have an elastic basically top that are good for showers for that. Obviously when you take a shower or in any situation, you don't want to get any of that bandages wet. Or you can just go a good old-fashioned bag over it. And I watched from another video where a lady wrapped saran wrap around it a couple times and got it, really waterproofed really well for her. And also obviously easier to take off than tape, around your leg. Might be a little more painful to remove. So definitely going to see how the shower goes at some point soon. But basically, relax, best I can. You know, I got the surgery now, so now I'm in the healing phase. Um, and I'll make a few more videos and just stay on track with what I'm doing, which is continuing to rest my leg, continuing to elevate it, continuing to ice it, continuing to use my medication, staying off it as much as I can, and I expect good things, you know, and I think that's part of it too, like I've said in my carpal tunnel videos, if you've seen them, where, you know, the more positive you are about this, going through a surgery, the better, you know, for you. So that's a good thing, mentally, and just thinking about the recovery, you know, and what that'll do for you in terms of your quality of life and having this thing taken care of. And so I hope you enjoyed the video. I'll send some more out as time moves along. I won't put a time frame on them right now, but certainly I'll do a few more as time allows. And thanks for watching.